For the Mental Health Awareness Week, we are showcasing different organizations which offer support, advocacy, and training around mental health, and offer support to different communities as well as our NHS staff. My name is Karol Kuczera. I go by the pronouns he, him. I work for NHS England and NHS Improvement in the Southeast. And in this video, I am joined by Jess Dunn from the Southeast Leadership Academy. And we have the pleasure to have with us Helen Jones, CEO of MindOut. So Helen, if we could start with you introducing yourself and tell us a little bit about how did it all begin?
Thank you. Thank you very much for inviting me to be part of this series of programs that you're producing. Yes, I'm Helen Jones. My pronouns are she and her, and I'm the CEO of MindOut, which is the LGBTQ mental health service. We're based in Brighton and Hove, but we are a national project, so we do work nationally throughout the field of LGBTQ mental health. And yes, we began 21 years ago, which does seem like a long time now, and a very different economic, social and political context in which we began. MindOut was started through some partnership work with local LGBTQ community activists and mental health service users and other local interested organisations. And at the time I worked for Mind of Brighton and Hove, where I was running mental health advocacy services. And one of the first things we did was to set up an LGBTQ advocacy project, which was one of the very first in the UK. So it was, at the time, it was really pioneering work. Of course, also at the time, there was very little research into LGBTQ mental health. I mean, now there is splendid, loads of really good research. But back in the day, there really wasn't. And there was an organisation called PACE in London, and they produced a report called Diagnosis Homophobic, which was looking at the experiences of LGBT service users and workers in mainstream mental health. And that was a really seminal report. And it's still really interesting to this day to read it. It's a really good report, and it really helped us to sort of solidify the arguments around LGBTQ mental health and take that forward, both in terms of service delivery, but also lobbying and influencing and trying to make the case for more investment in LGBTQ mental health services. So yes, and that's what we've been doing for the last 21 years.
Great, thank you. And I guess COVID must have had a significant impact on the delivery of some of your services. So how did you have to adapt due to the restrictions?
It's really interesting, isn't it, how flexible and adaptable you find you can be under extraordinary circumstances, because we have moved all of our services online in a way that we wouldn't have anticipated before COVID. And it has brought some of our plans to move more online much further forward, and we've done it much quicker than we might have done otherwise. Now, in some ways, we were quite well placed because we already had an online service. We run an online chat service, which operates out of hours and is an anonymous platform where people can come and talk about their mental health from all around the country. That's a UK-wide service. So we already had some experience of delivering online services, and we were also able to move things like our advocacy service could move online and be delivered by telephone and email really quite quickly. And of course you lose something from not meeting face to face, but you can still do an awful lot of very effective advice, information and advocacy work with people more remotely. And likewise, our group work service moved online. Now there, I think some people struggled more with using different technologies and also getting used to being in groups that aren't in person. There is something very different about the way we communicate online and in person. Yes. But I would say probably about 70 or 80% of our service users have actually adapted to that and found it to still be very useful and very effective but it's not for everybody. Online support doesn't work for everyone. And we found that quite a lot of people were asking us for telephone support. And of course, some people really don't have the privacy or the safety or the technology to be able to receive online support. We really needed to develop an alternative. So we set up a telephone befriending service alongside the other services that we run. And our online counselling service took a little while to get up to speed because there were some additional competencies that our counsellors needed to acquire, because there are some specific differences about delivering counselling online, to do with things like people perhaps disclosing more and more quickly online than they would in person. And again, issues to do with boundaries and privacy. Like a lot of other services, we dealt with all of those considerations as quickly as we could, and obviously now I've become much more practiced at it, and demand for our services has definitely grown over the last 18 months, definitely.
So I guess, the adaptability is really the theme here, and, how quickly we can kind of adapt to new environments, including the digital environments within which we often operate nowadays. But I'm wondering and thinking about the community that you deliver the services to. Are you seeing any themes that have emerged because of COVID?
I think certainly to begin with, and it's still the case even now, the impact of the pandemic has been really severe for people who were already struggling with their mental health.
Yes.
And people's support networks and how they were managing for some people, some really long-term, really difficult, complex mental health issues was really disrupted by COVID, and that left some people feeling absolutely desperate and in massive amounts of crisis on several different fronts. So for some people, the intensity of the support they've needed from us and the intensity of the work with them has been much, much higher. And a lot more people in crisis, I would say, and reaching that point of crisis a lot quicker. And often for some people, once you have experience of crisis, it can become a sort of cycle of crises. So one thing in your life breaks down, then everything else does as well. But some of the things that are particularly specific to LGBTQ people, I think, are there's a lot of issues about housing. For a lot of people, having to be in lockdown restrictions, in accommodation that is not conducive and possibly extremely unsafe in which to be LGBTQ, has been very challenging. And some people have had to go back into the closet. Some people have been living with hostile family. Some people have been living with domestic violence in many different shapes and forms. That's been a key issue, as has social isolation. And you can be with people and be very isolated. And the loss of LGBTQ sites of community, the places that we go to be LGBTQ and to be recognised by other people and to feel safe within a community that knows who we are, that's an enormous loss to any minority identity communities, and has had much higher impact for people from intersectional communities and with intersectional identities, because your access to those safe sites is that much less and that much more precious and that much more important to you to be who you are. The sort of ways in which people have felt isolated and excluded, both within our communities and outside, I think that's a really difficult problem. Access to other services was very disrupted by COVID and still is. And that includes mental health services, but also physical health services. And that's had a particular impact, I think, on the trans care pathway. So people who are waiting for treatments and assessments and to continue on any sort of trans journey, some of that, I mean, waiting lists was so awful already. You can imagine what COVID has done to them. Some people are waiting years for healthcare that makes a huge difference to people's mental health. Getting the support when you need it will make so much difference to your mental well-being. And I think it's a tragedy that trans healthcare has been put back so much. There's the extra impact that all the other social and economic fallouts from COVID has had on LGBTQ communities, where we have much higher rates of mental health issues than the rest of the population already. And that includes things like insecure work prospects and employment. And because there's an awful lot of, I think, hidden poverty in LGBTQ communities that has been made much worse by COVID. And I think that is another big issue for LGBTQ communities specifically, that it often isn't recognised.
What I'm hearing through what you said was that there is this need for safety, belonging, and also appropriate provision of services. Now, one of the places where we can potentially belong or feel like we belong is our workplace, which you already kind of touched upon. So are there any unique challenges faced by the LGBTQ plus community in the workplace?
I mean, obviously it depends an awful lot on what your workplace is like and how supportive it is and how explicitly supportive it is of LGBTQ identities. And the being explicitly supportive is really important. So it's fine in a workplace to say, oh yes, we believe in equality, everybody's treated the same. That's not enough. And workplaces where there's very visible, vocal, and constantly reinforced messages of inclusion specifically for LGBTQ people is going to make it a hell of a lot safer for any LGBTQ employees. So that's not enough in and of itself, but it's a very good start. And one of the things that we know a lot more about than we used to in terms of LGBTQ mental health is experiences of minority stress. So the constant stresses that people have around whether to be out, whether that's at work or elsewhere, how out to be, how much to talk about your own life in relation to other people's, how safe both psychologically and literally an environment is a sort of constant preoccupation. You're constantly scanning, and that's true at work as well. So anything you can do to preempt those kind of considerations in a workplace will make a huge difference to how people experience that sort of minority stress. How much mental health needs are recognised in a workplace will also really help. And again, positive approaches to mental health and to intersectionality, being, really appreciating what it means for people to have intersectional identities, because that can be huge. And all the other elements of good practice around LGBTQ affirmative approaches and spaces will make a massive difference to LGBTQ people.
Is there anything that our leaders can do to support LGBTQ plus staff and understand their needs, and just to be aware of when working with them through this time?
Well, I mean, I think probably the first thing to do, I would say, is to ask LGBTQ staff how it's been for them and what they need and what they would like from their leadership. So to consult, to ask the questions and listen to the answers as well, and to engage those staff in providing what they feel they need. And that may vary hugely because, of course, people's roles during COVID have covered every aspect of healthcare, haven't they? But I think this also needs to be in a context of, again, positively demonstrating positive leadership that is about talking about LGBTQ experiences, having out leaders, having role models. That, I think that is really important. People talking about their own lived experience of those issues will always encourage other people to. So it's leading by example as well as asking the right questions. I think you need to do both of those. And again, I know I've said it a couple of times now, but I would really emphasise intersectionality, and that to demonstrate that you've got an understanding that LGBTQ is an umbrella term, but it's within that is a massive amount of diversity, huge amount of diversity, and that you try and address that as positively as you can, telling stories, having information and spreading that in engaging ways all the time will also really help people feel confident about speaking up about their own experiences.
And I think it really, and you've touched on it slightly, it really brings to light one of the challenges that we're currently facing in the NHS is how do we diversify our talent pipeline as it's coming through? How do we make that more inclusive? How do we ensure that people are aware that those opportunities are for everyone, and that we want those voices to be heard? What do you see as some of those challenges that we're seeing around being able to diversify that talent pipeline and not just seeing the same people or the same groups coming through?
I think getting in expertise and devoting time to training and then planning what you're going to do as a result of that, I think that could be very helpful. Enabling people to participate requires capacity building as well. And so I think giving people paid time to participate is one way to do it. And also seeking out people who may want to develop skills and experience to progress within any career, and offering them a helping hand at the beginning. That sets up a chain of developing expertise for the future. For example, we have a counselling service, and we wanted to increase the number of trans and people of colour on our counselling team. And so we advertised, we said, trans people are very welcome to join our volunteer team. Not very many applicants. So what we've done now is we've developed a bursary scheme for trans and people of colour to train as counsellors, in return for which they'll get, I think it's up to about half of the fees, because it's expensive to train. And in return, they'll come and work for us for a year. So, we've had a really positive response to that, because that's about giving skills and experiences to our communities that will then, it's like a legacy. It goes on forever. You've always got those skills and experiences within your community then, and that's always going to be helpful. It's going to be helpful to those individuals and to our communities. So I think things like that, I'm sure there's lots of things within the NHS that you could do that are specifically targeted at the groups that you want to nurture and evolve into the sort of leaders of tomorrow, if you like.
It's rather lovely to hear what you're saying about how do we effectively influence building that pipeline for the future, and you start right at the beginning with that. So Helen, your website, which is the mindout.org.uk, has really some fantastic resources on it. So could you talk a bit more about the different projects that you're currently involved with and running?
Yeah, sure. So we have an advice, information and advocacy service, which is available for anybody with any kind of mental health concerns. And an awful lot of people come to us as the first service that they've ever really discussed their mental health with. And I think one of the things we offer is that all of our services are run by and for LGBTQ people who have lived experience. So people know that they will not face any kind of discrimination when they come and talk about being LGBTQ and having mental health issues. And for an awful lot of people, they don't get that anywhere else. We can signpost people to wherever is most appropriate to meet their needs, tell them about the other services that they can access through us. And we have a range of different services that people may use at different times and move through. So there's advocacy, which can be very helpful for individual concerns. We also run a lot of peer support groups. And what we found is that a lot of LGBTQ people with mental health issues want to talk to each other, to offer support, to tell their stories, to share how they manage their mental health issues at different stages and in different ways, and build up social networks, supportive networks around mental health. And that can be so transformative, especially when people feel like they're the only person who's ever felt this way. And for a lot of people, that's true. I know I felt that at times. I thought, I'm the only person who feels this awful. And it's such a relief when you find that there's other people out there. I think I've already mentioned our counselling service. So we run a low-cost, affordable counselling service that also rather uniquely has very short waiting lists. So, and that is something that we've always done very well at being responsive. I think it's really important when people have perhaps waited for a long time to get in touch, or finally plucked up the courage to get in touch with you and talk about their mental health, the least you can do is respond quickly. And we also now have a telephone befriending service, which was a relatively new addition. That goes alongside another service we run, which is a peer mentoring service, where trained volunteers offer to mentor somebody else around anything that any goals that they've got about community engagement, really. So it's another way of trying to break down social isolation, and also giving volunteers the opportunity to give something back, to again use their experience to the benefit of other people. And our online service is also run by volunteers. And that's been one of the really lovely things about COVID, actually, was the number of people who wanted to volunteer for us. It was really moving and also make donations, but the number of people who wanted to do something for other people has been really heartening. So we have a big volunteer team to whom we offer training and support and supervision and a team experience to deliver some of those services. We also offer training to mental health service providers, to community organisations and to corporate companies. So we've got a whole suite of training offers that connected to LGBTQ mental health and trans awareness as well. And we run general courses and also bespoke courses.
So Helen, before we finish, and you touched on it already, but I just wanted to amplify that voice. What's worth celebrating?
Well, I think for me, the power of peer support is what's at the heart of it all. That is really worth celebrating. The how it can support people and help people to share their experiences with others with similar experiences is just, it's brilliant. And I think that's something that MindOut does really, really well.
Helen, thank you so much for this conversation today. I mean, sharing your wisdom and telling us about your your organization. I mean, it certainly has, improved my knowledge, not only of your services, but also told a beautiful story about the sense of connection in our community, when perhaps at times we may feel quite isolated and disconnected. So thank you so much.
Well, thank you very much for having me.
Absolute pleasure.